April is Oral Cancer Awareness Month. One person dies every hour in the US from oral cancer. Most people don't even know it's something to watch for or something that they can look for themselves. Many people don't even look inside their mouth. They just put their toothbrush in and brush, and usually only once a day. You should be brushing twice. Because it's Oral Cancer Awareness Month, we're going to talk about the signs and things you can do to catch it early for yourself and your loved ones. Your mouth is more than just a smile. It's a window into your body, and it just might save your life. Although I did not have oral cancer, I had breast cancer. I did have warning signs in my mouth. So I am living proof that your body gives you warning signs and that you should listen to them. As a dental hygienist, I knew I had healthy gums. So my gums started bleeding when I got my new burst water flosser. I was like, I was using a water flosser. I was brushing my teeth twice a day, flossing. Why all of a sudden are my gums bleeding? Why am I tired? Why is nothing I'm doing stopping the bleeding? So I went and got my teeth cleaned to see what was going on. I had a couple of deeper plackets that I've had ever since I was 16 and I got my braces off. I was thinking, why are my gums not stopping bleeding? Something is off. It's obviously not my mouth health. I had some tests. I was told everything's fine. I'm just stressed. It was nothing to worry about. All of my numbers were fine. I know things can change fast and how powerful it is to catch something early. Oral cancer includes the lips, the tongue, the cheeks, the floor of the mouth, the hard palate, the soft palate, the sinuses, and your throat. Your dentist can't see down your throat, but there are certain signs that you can look for. There's a broader group of cancers called head and neck cancers, and it's often painless, especially in the early signs, and it gets missed because it's hard to see. Most cancers go undetected until stage 2 or 3. So hopefully your dentist is looking in your mouth. But if you're not seeing a dentist regularly and they're not doing an oral cancer screen, you can do an oral cancer screen at least once a month. Look in your mouth. Check for persistent sores that don't heal after 2 weeks. Our body's amazing, especially our mouth. It repairs and regenerates pretty quickly. So if you have something that hasn't gone away in 2 weeks, please get it looked at. Could be a white spot, could be a red patch, could be a lump or a thickening in the cheeks or under the neck, underneath here. You could have pain or numbness in your mouth or your tongue, difficulty swallowing, difficulty moving your jaw, chronic sore throat, or voice changes. If anything feels off, get it checked. Early detection when it comes to oral cancer increases survival rates by a huge amount. We use something called a Bell scope in our office, and it can detect something that starts below the surface. When you use the light, it shows something you might not be able to see with your own eyes. I've seen things on the soft palate or on the side of the tongue with people. A couple of times what I've seen has been nothing, but a couple of times it did end up being oral cancer. So having an oral cancer screen is going to be really important to be able to detect cancer sooner rather than later. While tobacco and alcohol are two of the main risk factors, we're seeing a rise in oral cancers among teens because of HPV and vaping. HPV oral cancers, this is something that didn't happen when I graduated hygiene school. It was mostly older people that were smoking and drinking. So everyone should be screened, not just at-risk people. It's not just about lifestyle, it's about awareness. Ask your dentist if they're performing oral cancer screening at your regular checkups. Do a monthly self-check, especially if you're not seeing a dentist. Stick your tongue out. Move it side to side. Lift your tongue up. Stay hydrated. Eat oxygen-enriched foods. Addressing chronic mouth breathing, mouth bleeding, inflammation, mouth sores can also increase your risk over time. If you're having any of these things, don't ignore them. Trust your gut. Get an opinion. Get a second opinion if you need to. Oral cancer does not discriminate. Any cancer doesn't discriminate, actually. I didn't have any pain. I had breast cancer. My signs started in my mouth. I did not ignore the warning signs because I was like, why are my gums bleeding? When they told me I was okay, all of my labs were fine, I was like, I don't think that's true. So for me, because I don't fall under the norm of most people with signs and symptoms, I usually have to find a couple different doctors that will listen to me and not just brush me off. So if you have signs or symptoms, you feel like something is off, find a provider that doesn't blow you off, especially if you feel something is not right. This month, I challenge you to take 60 seconds to look in your mouth differently. Look in your child's mouth. Pull the tongue side to side. Look in your mouth. Look under the lips. Back in the throat. There are so many different illnesses that start in your mouth first, not just oral cancer. If your tongue is yellow, if you don't have enough room in your mouth to suction your tongue out, If you have white tongue, hairy tongue, yellow tongue, your tongue is also a sign. In Chinese medicine, they look to see what's happening with the tongue. If we can detect these signs early, it can save your life. If you've been going to the dentist, you have bleeding gums, you've had a deep cleaning, you've seen the periodontist and things aren't going away, sometimes there's something off in your body. You could be an undiagnosed diabetic. You could have a thyroid issue. You could have thyroid cancer. Your mouth could be giving you a warning sign like it did for me. Don't ignore them. Do a self-check. Share this video with someone you love. Be the owner of your health. I have a friend named Susan Cotton that has the Cotton Method. You can even Google that and look up how she does a self-care exam. She's teaching dental offices to do better cancer screens because a cancer screen can save your life. Don't ignore this. Share it with someone you love. Like, comment, subscribe for more ways to be the owner of your health. Remember, look in the mirror. Do a self-check. Self-care is not selfish. It is essential. Listen to your body. Know when something's not right. A little thought that just pops in your head and you think, no, that's okay. Don't ignore it. You have instincts for a reason. Oral cancer awareness is really important. It saves lives. Your mouth gives you warning signs. Your mouth is a window into your body. Don't ignore them. If this was helpful, please like, comment, subscribe, and share. Until next time, have a great day.